Okay, we'll call our meeting to order. The only one missing at the moment happens to be Dennis. Has anybody seen it? Both of the Dennis?
And Laura, you did send out all the emails, so everybody was notified.
All right. Well, okay, so. Take a look at this, passing these bills and. Do we have any minutes?
We did. They were sent to us in our email.
Yeah, okay. So we have to vote on them tonight. So you seen these bills? Yep. Okay. You don't want to pass it back.
You signed it, everybody signed?
Yep. Well, let's see, we haven't got much of the agenda tonight.
Nope.
Already reviewed two bills and let's take a look at the minutes. Has everybody reviewed the minutes? Heidi,
I'm helping Cheryl. Hold on.
has everybody reviewed the minutes?
That's what we were just
We
talking
have,
about.
Okay.
I would like to make the motion to amend, to accept the amended minute.
No,
the
to
minutes
accept
as
the-
presented.
The minutes.
The minutes as presented from June 17th, 2024.
I'll second.
Okay,
I
does
second it.
anybody have any questions or additions or changes to make? Hearing none, all in favor?
Bye.
Aye.
Wonderful job as always, Lori. Thank
There
you.
you
Thank you.
Joyce, I have a health agent's report from you.
Yep.
If you want to run through it.
Yeah, nothing overly exciting. Wells at Pottle Street are in the beginning process. We permitted, so my guess is that they'll start drilling any day. As you can see, the top, the pending projects, no changes on those other than I sent back a request for 48 Evergreen because the flow on the current design plan is not correct. So they need to go back and redesign it to meet the Title V requirements for, basically it's considered a nursing facility. It did clarify this with DEP. So they have to change their flow rates to 150 per bedroom to accommodate for the added staff and use of the facility as a whole. So that's on hold till I get new plans. Complaints, Spring Street, that a complaint was issued to both this is a carryover from the last meeting, to both the occupant as well as the owner. Occupant more than complied rather quickly. The owner has not completed the work, and I'm going to send one more warning, and then I'm just going to court. Because he's not doing what he needs to do. 12 Bagnell Road, I will be going to work early to go observe, because there's multiple complaints about somebody putting out bird seed, but large quantities and it's attracting large amounts of pigeons as well as rats. But every time I go there, because I've been there probably 3 or 4 times now, I don't catch the pigeons. I don't not believe what's being reported. It's just I haven't seen it. So I'll be going out there early. And then Baymont Shelter, just issues persist. When I get them, I have notified the shelter manager that what's being reported, and they, because we don't really have any teeth on this matter because the state runs the shelter. As was told to us in a meeting, Keith and I had a meeting with the people who operate, who are in charge of the shelters, and basically we don't permit. So, and if a complaint was to issue, it would be issued to somebody who's living in the shelter. So therein lies the problem. The issue generally, as a whole, is because people are not abiding by food storage rules or cooking rules And so it's an ongoing issue with pests. The shelter is dealing with it, but it's kind of hard to eradicate something if people aren't following rules. So it's really on the Executive Office of Housing and Livable Communities to address this at this point. But I just follow up, and I did receive a call from the Boston Globe. They they put in a request for information for all the complaints associated, so my guess is, and I spoke with Keith about it as well, he's received a number of calls from the Boston Globe as well, so I'm guessing something is coming down the pike. But I've just explained to the person that this is what I can do, this is what needs to happen, and if somebody doesn't let me in their room, I can't go somewhere that I'm not allowed to go legally. So that was pretty much the end of that discussion with the reporter. As far as inspections go, we're actually doing quite well with restaurant food inspections. Everything's up to date. We have had pretty great compliance with any outstanding issues. People are fixing them. They're getting in line with how things should be. So that's been nice. I did do inspection on Camp North as well as the Burn basketball camp. Hockey Life, which is going to be at the Bog. The basketball camp is at Silver Lake. And while I was going to do that, discovered a unlicensed camp at the high school. Issued information to that group and they need to get everything in. I also sent a letter to the superintendent of the schools, who I would have assumed would be clear on that camp permits are required. So anybody that's using the schools has to have a camp permit. So hopefully that will rectify the situation. I met with the DEP liaison and with thank you, Jane, from the recycling committee to discuss hauler issues. I did let them know that we've instituted fines and what are we, three out of how many we've already
3 out of 6 or 7.
Yeah, in one of the problematic ones has turned it in. So the threat of fines seems to be motivating people to do what they're supposed to do.
That's good.
That's amazing. And then I attended obviously the grant committee meeting. There's nothing really there to report. It's just the same old as far as operations. We did get some sandwich boards that we can put out. That was part of the grant spend down, so they're up in the attic. They're just the folding sandwich boards that we can put outside if we have messages. We are going to hopefully be doing CPR training and instructor training as well. That will probably be sometime in September. And then I've attended the Plymouth County Mosquito Control Commission. And we have posted on our website the contact information so that people can request. That should not be coming from me. That should be each resident has to call, because then it becomes the issue of if you want it and she doesn't, they have to call, and that's between you guys and the board. The health department is not getting involved in that. We have also posted updates on the EEE threat, which remains at moderate. It's low for West Nile. We've tried to put out some information about what you can and can't do. We got a message on Facebook today asking why we don't call people, the residents, and we just posted that if you are concerned or have any questions, that the state posts everything, you can check it, it's updated, that the state is who does the testing and not the department.
Do we ever, I didn't notice it, but I was more admiring our new memorial. Do we have the sandwich board out for AAA?
Not yet, no,
Okay.
no.
The tick one was out there. wasn't
Yeah,
it?
we put a tick one out, so we can put the EEE one out as well. Get that out tomorrow.
We've got them upstairs. We might
Yeah,
as well use them.
yeah. And then I attended a training on nicotine-free generation through MHOA. It's just a program that they're trying to, dissuade young people from. It was interesting. I think that what we have in place is good, and I wouldn't not consider it down the line, but I think we should stick with what we're at right now. And maybe broach that in the next year. Because it requires mandates to not sell to anybody over 2000. If you were born after the year 2000, you can't buy cigarettes in the town. So we may need to obviously change that date, but it's the whole idea is to limit people's ability to buy cigarettes, which I don't necessarily disagree with, but I think there's some things to consider because you're making decisions for people that I don't know that that's the direction we want to go. But it was an interesting, the bare minimum was an interesting topic. Definitely maybe some other things we could look at to do that.
Did they offer any helpful parenting tips when it came to stuff like that?
No, this is more for
For us.
health departments, yeah, in policy implementation. It's really
I was
not
like,
geared
okay.
for for parenting around that.
It was just,
Yeah.
we could throw it on the website if they had. that's
Right,
all.
yeah. And then septics, we've had a couple perks, a D-box replacement. We do have projects upcoming. I know Charles Street, they're moving on 3 more, or Charles Drive, excuse me, they're moving on 3 more houses. So that's pretty much it.
Okay. How are we doing with the beach testing?
That's fine, that's all good. No issues there. Everything's coming back great, so thank God. Probably just jinxed us.
On the mosquito program, you
Mhm.
posted it online with the contact phone
Yep.
number. for Plymouth County Mosquito
Requesting, yep,
Control.
you can request to be sprayed by using this number, because it's gotta go through them.
They do that up to 10
information I
times
have.
a year season.
It's 8,
Is it 8 now?
so.
Yeah.
Probably depends when the frost hits.
True.
The
Well, you all
information-
know that the mosquitoes that carry certain diseases don't come out till July and August now, so this spring and like May and April that people are paying for is completely useless. Doesn't target what
you're
is the
looking to
issue,
target.
so now is really the time people should be focusing on cleaning up the
Water.
water and
Yeah.
cleaning gutters and that kind of stuff. We posted all that.
Mhm.
The information I was able to get from the director after I talked to him was, when you call, you sign up to have the spray.
Mhm,
It entitles you to 8 applications,
mhm.
and you're the one who has to call to trigger the individual applications.
Yep.
You don't just automatically get
Get it,
them.
right.
You have to call for the second, you have to call for the third one.
Mhm.
So unless they make those calls.
You won't
And
get
that's
sick.
why we directed him to the commission.
Right, oh, no.
Everything should be through them.
Oh, yeah.
It should be, because I feel like oftentimes people hear what they want to hear.
Yeah, I
We're
know.
giving them information,
Yeah.
it's, oh, you didn't say that, so it should just go straight through that's what they're there for.
Okay, and our smoking regulations are modified, updated smoking regulations are ready to have, excuse me?
I think they're in the folder. Is your folder?
Simon.
Oh, this is the example for release. She put it, and then this
Whenever
is
you're
to
ready,
be,
you can sign them and get them posted. up
this
on
is
the
to
website.
be signed.
There you go. That was good.
Hey, we're on it, Joe. We try to be
Oh,
anyways.
listen. I know. Now, the situation with these. With the water.
With the water.
It's not really a thing, but.
Hold on.
What are you
What is
talking
it?
Building
about?
moratorium, there's a building moratorium right now in town.
Well,
because
no,
it's
there's
not-
a water moratorium, which is restricting any building that wants to be on town water. If you have a private property and you're gonna put a septic and you wanna put a well, we don't necessarily have a moratorium on that.
they can proceed.
Yeah,
With that.
we have nothing, there's no moratorium on that.
So have you gotten many applications? for that?
Right now, I have 2 pending lots on Station Street. Those will require wells, I believe, and Kennedy Drive is the other one. But that one already has a well. They're just redoing the system. That the Kennedy Drive one's just a redo. The ones on Station Street are 2 undeveloped lots, or 1 lot that's gonna be split into 2. So between those Station Street, 2 lots, and the Pottle Street, those are the only well applications we have at the moment. I believe, I don't think we have any other open ones.
Oh, there's Park Hill?
That was done a long time ago, though, right?
I didn't think so, but.
I don't, we'll have to check on it. There may be an open, I know we signed those a while ago, but nothing seems to be moving fast as far as that goes. So I don't know what the holdup is for why it's taken people a long time to drill.
Okay, well, I have something else, but I'll bring it up some other time.
Okay,
Okay. Okay, we signed that. Posting the names of the businesses that are non-compliant of the town and social media. What's this now? To the town website and social media.
we talked about it last week, to be able to put who has violations against them and what their loss of, that so-and-so was found in violation. They have a loss of license to sell tobacco products for 7 days. Because the more people that know about it, the less likely is somebody is to violate that sales or non-sale, as well as it also affords people the opportunity to be aware of what businesses they are supporting that aren't complying with tobacco regulations. So you as a parent may not want to go to someone who has 3 prior violations because they keep selling cigarettes to minors. So if it's out there,
So is this
social pressure is a wonderful thing.
so is this just in regards to the tobacco, or is it?
At this point, I think that it should start with that and let's see how it goes. I think if we have cases of, say, restaurants who repeatedly are non-compliant and fail to fix compliance issues, that should be posted as well, that we are, there's towns that post every time there's a violation of any kind, they list them every month. I don't know that we want to go that far right out of the gate. And I think we do need to be conscious that not all violations are equal. If somebody forgets to hang a mop up and it's sitting in a mop bucket, technically you get written up for that, but that's something that could be corrected on site. And that certainly shouldn't be made a huge issue out of. It's an oversight. But when we have people who fail to fix equipment, continuously have food that maybe isn't being held correctly, or what we refer to as critical violations, that's a public health concern. You not hanging your mop up, it's not great, but you're not gonna kill somebody or make somebody sick.
I think I put an example of one. Joe, is that it from you that another town was doing on the table?
No, the thing that's down,
Now,
Oh. Talk to me about camps. What constitutes a camp?
I mean, what constitute a camp? You call it
Let's
a
just-
camp. First of all, the word camp is in there. You are hosting children under the age of 18 for consecutive hours over consecutive days to engage in an activity. It doesn't matter. So like we have somebody here that has vacation Bible study. That is not a camp. They're just going to the church. They're reading some scripture. They're playing games. That's not considered a camp. They call it a camp, it's a camp.
Okay.
So if they called it a training session,
I can't touch it.
you can't touch it. So maybe, okay.
But this is,
What's the
I
point?
spoke to if we're talking about the one in Silver Lake, I spoke to the person who runs it, or the person's daughter, who said it's a camp. It is not training sessions.
Yeah.
It is a camp.
Okay.
So
What's the fee for the permit for the camp? Is
I
it?
think it's like 150, 125. It's not a lot.
$125.
Yeah, it's not much.
So regardless of the size of the camp.
Yep, we don't nickel and dime people.
We
No,
just
no,
wanna know you have a
just-
camp.
just-
Yeah, and it's specific, and the reason why, I think it's important to understand why these camps need to be licensed. You are talking about children who are unsupervised, meaning out of a parent's control. Camp regulations require anybody who is in the camp, that's running the camp, needs to have a Cory and a SORI check, so that we know who is taking care of these children. There are policy guidelines that outline what safety procedures are in place, what is the pickup? How do you verify that somebody is the person that's supposed to be taking that child home? Medical, they need to have a medical person on staff to oversee, vaccination, medical issues. If there's somebody that has an EpiPen, if there's somebody that needs medication, it's like very spelled out. And this isn't my rules, this is the state's rules. So it is important that we adhere to it and that people who want to have these kinds of programs adhere to it. It's really for the safety of kids, and just having these programs, if I was a parent, I don't know that I would feel comfortable sending a child to somewhere where you don't really know who's volunteering, who's working the camps, so.
Okay, I want to know my own. Just wondered.
Oh, I'm very well aware that there's other people out there that
Well, I
are
don't-
running them illegally.
I just
So what's
know
to
of the
keep
camp,
people
I
saying it
don't
was
see
a
anything.
training session?
There isn't. I can't do anything about it.
Okay, I just wasn't sure, like, who's to say, oh, I'm not gonna call it a camp, I'm gonna call it
That's
a
why I asked the
training.
question.
Yeah, I'm just training the kids.
There's
to
a
do
difference
that.
like the high school kids that go and do like captain's practices and sports
Yeah.
training.
That's exactly
That's-
what I'm thinking.
Part of the school, and that's part of the school curriculum, and that's not technically a camp. They're part of a team. They practice, they do it on and off school hours. That does not meet the definition of a camp. But like the basketball camp that was at the school is a camp. Those kids it's
Right.
different ages. They're not part of an
Right.
organized team. People are sending their kids to go there
Right.
for, a fixed period of time every day for a week.
Oh,
Okay.
I agree with it 100%.
Review of Board of Health regulations.
Come again?
Review of the Board of Health
Oh,
regulations.
so I had a couple questions. So I'm trying to look at what is in place, where are those documents and when we go in the files on the computer, we have multiple copies of multiple things for the same stuff. And there's half of them do not have dates on them, so I don't know what was written when and what supersedes or has replaced previous. So I'm just wondering if we have a central location. Do you keep a book prior to my arrival here? Because it would be nice to have all of the regulations, look at them, see, because it could have been done 20 years ago for all I know. And look, has anything changed in the rules? Do we need to update everything? Or is this great and we just reaffirm it and put a date on it as of that we're, keeping these regulations as is with a, we've unamended version as of 2024, so that, when my tenure is over and the next person comes, it's clear what are the current regulations, when were they last reviewed, as well as being able to post them on our website so people have access to what is
Why don't you
expected.
put together everything that we have currently,
Yeah, I've been going through them.
make a file for all the board members, and I'll go through them and we'll go over them in the meeting.
Okay,
They take more than one meeting.
I was just gonna say,
Well, and I was
I
just-
suggest we do like we break them down to like 5 a meeting that we go through and we approve.
well, and there may be some things we don't need to
Right.
do, like the septic, if nothing's changed.
Like
with
tobacco.
Yeah, the
Because we
tobacco
just
stuff,
did it.
right, and septic, I doubt there's gonna be, there may be some things we need to look at, I don't know. But I just don't know, I know the animal regulations, we don't have to do, those were just done. But it's just a matter of finding what else is out there that we may need to look at, that's all.
I have a
That's
feeling
more of
there's-
an asking a question than
I
anything.
have a feeling there's quite a few that you probably use
Yeah,
eyes
they-
on.
So if we break them down into increments, so we can go through them.
Okay. All right. We can do that. That's it. That's really, there's the only question.
So unless anyone has any new or old business.
No, just a minor question.
Yeah,
I know for. So I don't care if it changes, it's your business, but for 24 years, we always worried about. Mosquito control, the schools, they'd call us, we'd handle everything, we never had a problem in 20, so now we don't have to do anything. We don't care.
I'm not sure what you mean. That's
Well, we
not,
used to handle it.
no, when there's an issue related, like, I got a call from all Board of Health, all health agents get a call when the triple E moderate threat, we all get notified. They ask me specifically what parts of the town I want sprayed. So because it was right before 4th of July, we did Grays Beach, we did the athletic fields, we did Pottle
Oh,
Street.
so
we
you're,
did the rec-
you're doing the.
Yeah, that I'm
The
responsible
public
because
areas.
I'm the,
And the
I
school-
am the
and
town
the
of
schools.
Kingston, so to speak. Yes.
Oh, okay.
Um,
I just didn't
well,
understand
I
because
I
it's short
can
and
do
sweet.
Kingston schools. Because Silver Lake, I suggested they do the athletic fields, but they can, I guess, confirm with Silver Lake Regional because they oversee the school.
It's still in Kingston though.
Yeah.
So
Well, I have my mosquito meeting and when I see, when
You
I
can
go, I'm
ask
gonna
us.
talk raw. I'll
I
ask,
requested the other day.
yeah,
They spray those fields.
which is fine. I mean, I don't think it's a problem at anybody's calling to request that.
Yeah.
But just so you know, when that does occur, the health department requests that public areas be
You're
sprayed.
perfect as usual.
Oh, gee, thanks,
Any
Phil.
property should be sprayed. We have persons gathering on them.
You took care of
Well, especially with the risk of triple B being of it.
Oh, absolutely.
That's why when I saw where the triple E was going to,
Yeah,
No, I'm not-
I called and I said, let's do, because I had talked to you about it.
Yeah,
And so I said,
and I had
I
already,
called and said, please,
then-
make sure you spray this.
3 weeks ago?
yeah,
Yeah.
and I already called when and that came out and told them, please make sure you do all the main public areas, because we have the farmer's market at Grace Beach.
Yeah.
Not every week, but still, and obviously
But
people
we have
hanging
the
out down
playground
there.
right there.
Yeah.
Right,
You know, and especially like
there's a little
around
stream.
the middle school and the high school and also by the elementary school. I feel like the elementary school and the intermediate schools aren't used as much during the summer, but the,
No, but it's still good to spray just in
but
case,
let's try
Stay on
and
it.
mitigate and keep people.
right?
getting
So
sick.
that's all to, just to clarify, are we saying it is all right to do the posting, the
Yep.
tobacco, okay.
For tobacco.
I just want to clarify, I needed to hear that it was.
I think we need to ease into it.
Yeah, that's my thought too, is let's start small and we can go up from there. And I think, that perhaps the best way to do it may be to broach it at a board meeting, to say, this is what's going on, I'd like to post this, issue, so that it's not just me deciding that it's brought to the board for the board to support or say, yeah, can we hold off and let's try it, just give it some leeway that way.
Okay.
All right.
Good.
Pharmacist retired, you know,
I know.
he got a better job somewhere down near his house.
Did he? Because I heard he was out sailing.
Who's this?
Glenn.
No,
Yeah,
Yes.
yeah. Cause I looked for him about 2 weeks ago.
Yeah.
He's told me he's gone.
that's not good. No, that's
No,
bad, because
that's
he
our
does
Glenn
our
Glenn is that
clinics.
guy.
He's the
Yeah.
one who does all the flu shot
Yeah.
clinics.
Well, I will go talk to whoever's in charge.
Lisa's pretty nice
Say,
over
yeah,
there.
Lisa's very nice.
She's very nice.
She's gonna be out with a baby, I don't, for a while,
Yeah.
so I don't know what'll
All
happen.
right, well, I'll get on.
They
it
asked
sooner
me if we
rather
could
than
find him a
later.
pharmacist to take her place.
Gentleman there. I've seen him there a couple.
I haven't been,
I'll talk to the store manager
yeah.
and just see.
Next meeting date,
Well, the next, in 2 weeks will be this July 29th. 3 weeks will be August 5th. 4 weeks will be 8/12.
the reason I'd like to go to August 5th is that maybe we can get back to our first and third.
That's fine. You're not
Okay.
gonna get an argument from us. If anything comes up,
Yeah.
I'll just call you. But I can't, it's pretty slow, as far as the need.
Variance.
Yeah, I've got nothing pending.
That August 5th.
August.
No, it's my nephew's birthday, but that's about it.
Well, we'll get
But it's a Monday, we'll
We'll get
celebrate
stuff
on the
out of it.
weekend.
A rotating schedule.
Yeah.
Anything else? Laurie?
I have
Okay. Joyce?
I've got nothing. I'm just looking up the date of
Okay.
August 5th.
Should to adjourn. Oh,
Motion to adjourn.
sorry, Cheryl. I'm sorry. I'm like,
Motion to
wrap it. Second.
All in favor?
Thank you.